And fortunately, Western medicine, MDs, also known as allopathic medicine, fortunately, that branch of medicine, or that philosophy, is embracing a more holistic approach, a more functional approach. I'm not going to give Western medicine and MDs any credit for that. I think it's the people are insisting on being seen as an entire human being, treated as a whole human being, listened to for the cultural background that they may have, and the cat's out of the bag because we now have the internet. So people want their doctor to be up on turmeric and garlic and different things that aren't just traditional Western medicine. So I was drawn to herbs, herbal medicine, and what I would call Eastern modalities in my early childhood. I couldn't exactly tell you why, because I'm from Houston, Texas, and I was born in 1965. I did take a yoga class once because I had a really forward-thinking swim coach who introduced us to yoga and meditation, which was amazing and definitely stuck with me lifelong. But it was not, like, it was considered witchcraft when I grew up. But anyway, be that as it may, I had that natural bent. So I spent time considering being a naturopathic physician. I mentioned the midwifery option. And my father was a very intense orthopedic surgeon. He went to Baylor in Houston. He was the Houston Oilers football doctor, if you remember the Houston, too young to remember, but the Tennessee Titans used to be the Houston Oilers. So in the 70s, when they were actually a decent ball team, Daddy was their doctor, and I had the privilege and the absolute joy of growing up in the Astrodome and being able to be on the field, on the bench with Dad, taking care of the patients, the players, getting to know them at our home, sometimes for dinner, that kind of thing. I never wanted to be the kind of doctor that my father was, because he just seemed really angry most of the time. Turns out it was really just his personality, not necessarily the job, I guess. But I lumped it all together. He was up really early. He was not particularly open-minded. Yeah, it just seemed kind of icky. So I wasn't pre-med in undergrad. After undergrad, I was in a horrible ski accident, and I had swam in college. I was 19 years old. I was in very good physical condition. I'm in this ski accident, and I herniated a disc. And remember, I was all this natural and herbs and stuff, and I wouldn't take a Tylenol. I wouldn't take any pain medicine. And the school nurse convinced me to see an acupuncturist. Well, I was not interested in anything that had to do with needles. I thought that was super weird, quackery, I'm sure. But this man was from China, and he was an MD. So I thought, well, I'll go see what he has to say. So I go see this MD, little Chinese dude. He puts some needles in my ears. I'm gonna not drag out the story that can be dragged out. Blah, 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 yada, yada, yada. I got a whole lot better. My dad wanted me to get surgery because back then when you had a herniated disc, you just went to surgery. I stood up to my father. He was in Texas, and I was at Lewis and Clark College in Oregon. Now you know why I went to undergrad in Oregon. It was either Oregon or Maine. How far can I get away from Texas? And then a few years later, not a whole lot of years later, but a few years later, I just kept being drawn to the healing arts. I wanted to help people. I wanted to live in a rural area and make a good living and not be dependent on a man for my living. And I was drawn to medicine. I flew back to Portland, Oregon. I was living in Crested Butte, Colorado at the time. I flew back to Oregon, which was a really big deal. It was a very expensive plane ticket. And we didn't have the internet, children. We did not have cell phones. It was crazy. And I met with the old guy, the little Chinese doctor, And I asked him his advice. I said, I want to be a doctor like you. And he said, you need to look at osteopathic medical school. And I had never heard the word before, and he wasn't familiar with it. He said, look, I'm from China, I'm an acupuncturist. If I had known what a DO was, I would have gone that route. So, a doctor of osteopathy, I like to say, fuses Eastern and Western medicine. That's not really true, and I'm just gonna be honest with you all here. That's why I'm here, is to be honest with you. I don't know the answers to everything, but I'm gonna be honest in my own opinions and my own experiences. I think that when our founding father, Andrew Taylor Still, founded osteopathy in the 1800s, he really did incorporate a lot of Eastern modalities. The only thing that's really left is the hands-on manipulation that you learn in DO school. But it's becoming, those lines are getting much more blurred. There are less and less osteopathic hospitals. There are less osteopathic residency programs. And there's a movement now to really combine the MDs and the DOs. Interestingly, there are more and more DO schools sprouting up, and if you go to DO school, you do still learn the hands-on techniques that are really helpful for a lot of musculoskeletal things. But it's not, you don't learn about herbs. It's not really Eastern medicine, so I just want to lay that out there. If you want to practice Eastern medicine, you still should look at naturopathic school. Did that answer your question? Yes, ma'am.
How would your father react to that? Like you doing a DO?
Oh, that's a great question. Not the first time Daddy decided I wasn't worthy of speaking to for a period of several years in a row. Yeah, he was furiously livid when I chose to go to DO school, because in the in the late 1800s, when osteopathic medicine was born, for the first 100 years, DOs were looked down upon by MDs, okay, considered second-class citizens. Of course, they were threatened and didn't understand what we were doing. So my father grew up with that thinking, and in the 1950s, late 1950s, a law was passed, a federal law, that DOs could not be discriminated against. So it's on the law that we get to do everything that MDs do, but you'll still find some people who just don't really understand, and there is some discrimination. I will share with you that when I went to medical school, was it 1887, a little bit after that, there were more DOs going into subspecialties and specialties. And then I've been out of school literally since the last century, so I wasn't aware until I started dating a young man who was applying to DO school, or he was applying to med schools, and he is really up on the latest, and I now agree with him based on data, that DOs are not very widely represented in the specialties and subspecialties. So this is years beyond where any of you all are today, but if one were considering a specialty or a subspecialty, I would recommend going the MD route, because I think you're going to realize your goal and your dream that way. But if you love primary care like I do, then I think the DO route is better than the MD route, because you're going to have that extra modality of doing the hands-on body work that we learn in DO school. Did that answer your question? Okay, yeah. Yes, ma'am.
Hi, I just wanted to say I really resonate with your story, because I have changed my path multiple times in college myself. And I also wanted to ask, how do you marry Eastern and Western medicine in your practice? Because I've found that a lot of very staunchly Eastern medicine, very staunchly Western medicine, and there seems to be a little bit of a war between what is correct. And as you said, you did want to take a Tylenol when you were 19. I'm sure
That's a great question, and thank you for asking it. It's something that I still think about. I have an intern right now with us at my clinic, and I just started going off on this tangent today. I said, because she gets to be my therapist. When you're an intern, you get to be the therapist for your boss. I said, I am frustrated. Why do I keep attracting all these people? In my deep, hardcore friend group, love these people, but they're into crystals, and they, and I do do a lot of yoga, but I know that crystals don't actually confer healing. I know that essential oils aren't gonna cure cancer, but I'm still frustrated with other people and myself and people in Western medicine and people in Eastern medicine. But here's the bottom line. It's just the human brain. The human brain wants to put things in categories and label them and make it all pretty and neat, when we know life is messy and medicine is no different. I reconcile the Eastern and the Western on a regular basis. I like to think that I am not ever throwing the proverbial baby out with any bathwater, and I draw from both. So my final patient this evening, before I came here to y'all, was a guy who I hadn't seen in 2 or 3 years, but he comes in when his neck is bothering him. He gets a herniated disc on C7, kind of slips in and out. He's like 63 now, something like that. And when the disc is herniating, presses on that C7 nerve root, and he experiences radiculopathy, and he has weakness and tingling, especially in his index finger. Classic. So, what did I do? Well, I have these beautiful osteopathic manipulation tables that were built in the 1930s. They are gorgeous. And I put him on the table and I did some gentle manipulation. At the same time, I asked my medical assistant to go get an injection of Stadol, which is a really wonderful muscle relaxant opioid combo drug. And he left with a prescription for some Percocet. So I just pull it all in there and give it all to him. I also have one of the, this is going to be controversial. This is going to be controversial. Do you care? I have one of the few coveted state of Texas marijuana prescribing licenses. So we don't have medical marijuana in Texas like other states have it, where you can just go somewhere and get your medical marijuana. We have very few licenses in the state of Texas. So marijuana is not a drug for me. Don't worry, I've tried it plenty. It isn't my thing. But I've come to respect, because we have evidence-based medicine, and there is evidence that THC and CBD are very helpful for a lot of people, for sleeping, for pain, for post-traumatic stress disorder, for depression, for anxiety. It's not a one-size-fits-all. And when you're a prescriber of this medical marijuana in Texas, we can only prescribe to state-run dispensaries, and I work with a woman who has a master's degree in marijuana. Like literally, okay, everybody wants to change their major now. Yeah, she has a master's degree in marijuana. I think she got it at the University of Texas, but I don't know. So I work with her because I don't try to figure out like how much CBD or how much THC for something. So I'm always good about calling in an expert, but I consider, marijuana is an herb, right? Is it an herb? Sure. I'll call it Eastern medicine. Did I answer your question? Okay. Yes, ma'am.
Quick thing, and I have a question as well. If you have a question, raise your hand and we'll bring the mic to you. But my question was, DOs like yourself are explaining osteopathic medical treatments to your patients. What are some reactions that are memorable for you that you have encountered while suggesting osteopathic medical treatments?
All right, here's what we're gonna do, because almost everyone is done eating. And look, we didn't even plan this. Y'all are paired up at these tables. This is not mandatory, okay? But if you want to, I'm going to invite each of you to do an osteopathic manipulation for your table partner. Then let's get their reactions, then I'll answer your question. I think this might be a little more interesting. Okay, here's how it's gonna start. Are you down?
Yeah.
Okay, come on. Okay, so here's what you're gonna do. First of all, what have I learned from the young people? You ask permission before you touch each other. I am so glad that I lived long enough to learn this. Thank you all for teaching us. So you ask permission.
Absolutely.
Okay. So I think sitting is going to be best. So the person who's giving is going to be standing. The receiver will be sitting. And you're going to start with your hands on the back. Yeah, go ahead. Let's go. Hands on the shoulders here. Thank you. And then fingers. Let your fingers travel to find the spine. So you'll feel those little bumps, right? Those little bumps. You know what the spine is. Ask your neighbors, your neighbor from a different table. And then just itsy spider. I'm moving my fingers like this. Up until you feel the back of the skull. Whoa, there's a bone. Feel that bone on the back of the skull? Okay, now, when you feel that, let your fingers travel right and left. This is the occipital ridge. We love the occipital ridge. So my fingertips are like this, palpating the occipital ridge. By the way, palpating is a great word to warm up to, because when someone comes in and I'm palpating their breast tissue, we don't want Dr. Freeman feeling your breasts. Dr. Freeman's palpating your breast tissue. You know, it tells you what we're doing and what we're not doing. So, does anyone want to share how this feels? Any of you receiving?
It feels cold.
So keep your fingers, if you will, give you permission, in his hair there. And let's go from doing this, because now you know where your landmarks are, and just let your fingers be gentle on that occipital ridge, and then a little bit of massage. Now my lovely partner likes her head to go forward, so you can put your hand on their forehead. And then there's a little bit of tension where I'm just gently pulling her head towards me, and then I'm pushing back with my other hand that's on that occipital ridge. Massage there. Does this feel bad to anyone? Does this feel good to anyone? This is usually the crowd pleaser, yeah. And it's nice because there's no contraindication to this treatment. So you could have a brain aneurysm, have retinal detachment, all kinds of scary stuff you gotta think about when you're doing manipulation on the head and neck. Suboccipital tension release, which is what this is. You just go, 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 go.
It feels very comforting and relaxing.
If I have thank you. All right, now switch. Okay, switch partners. Oh yeah. Good time. Good time. Ask permission. Yes. Okay. me to start? So I see people of all ages. Family medicine treats people of all ages. We like to say cradle to the grave. And if I have a kid who's super hyper or irritable or just, not listening, I'll put my hands on their occiput and do this little trick, and it mesmerizes them and it calms them down. Yes, sir. The idea is like masturbating. It's better than nothing, but it's not nearly as good as someone else doing it for you. Just being honest. Yeah, so I can see it here and do this. You can impress your family members when you go home for the holidays. It's a little party trick. Okay, so who wants to be brave and share how that felt? Answer your question.
Raise your hand and we'll come find you. Answer. It's not that bad. Come on. How was that?
Did it stop feeling cold when she kept her hand? Yeah. Good. Yeah. That was good feedback.
What about you, Ashley?
I didn't hate it. It was not bad. I feel like
His technique was probably a little bit lacking.
Yeah, it was probably lacking.
Well, it's his first time. We'll give him some grace.
It was good.
I heard calming, felt calming and reassuring, I heard, yeah. So that gentle little technique can get rid of headaches. Not all headaches, not necessarily, but I've seen it many times, relieve a headache. So, how about that? You guys are so cute. What else? Yes, ma'am, in the back. If I went down the MD route, I would perhaps be the same person I am today, but I think that I would have been ripped off because I wouldn't have gotten the education that I really value, which includes the hands-on work that I get to do for people, the osteopathic manipulation. So, get this. I want to make it not long. I love telling stories. I'm a good storyteller, but it could be long. Okay, so at one point, I was back in my hometown of Houston, Texas. I had the beautiful experience of doing my pediatric core rotation with the man who had been my pediatrician when I was a little girl. He went to Baylor School of Medicine with my dad in Houston long, long ago. And one day I'm having lunch with Dr. Everett in his little break room in his little clinic, and he said, "Georgeanne, I just gotta tell you something's really been weighing on me, and I've been talking to Trish, his wife, about it, and I feel like I'd be remiss if I didn't say something. Look, your father's a really difficult man. I've known him a long time. We're not friends. But I don't know if you know this. He's moved his office and he's in this building. And Trish and I just think, it'd be a shame to be all the way down here in Houston for your rotation and not see your dad. And your mom says you and your dad aren't speaking, and I don't want to get into it. I don't want to hear about it. I don't want to know about it. I'm sure it's your father's fault." And it didn't take much. Dr. Truitt could recommend anything, and I would take his advice because he was right. And he was right in this regard as well. And I ended up having lunch one day with my father, and he got in that big white Cadillac, and he couldn't turn his head because he had a stiff neck. And in medicine, we call this torticollis. And I couldn't probably sarcastically, about his torticollis. And he said, yeah, it's torticollis, I'll get a steroid shot, or I'll do, blah, 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 it'll go away. And after lunch, which was amicable, I said, hey Daddy, I noticed you have those big physical therapy tables in your clinic. If you wanted to, I could just do some gentle manipulation. You're really hurting and you have very limited range of motion. I love my imitation, oh my God. He acquiesced because when people are in a whole lot of pain, they get desperate and they'll let somebody do about anything to them. So I lay this giant of a man down, did some gentle manipulation, starting with what? Suboccipital tension release, people, and restored almost 100%, all ranges of motion. There was no high velocity thrusting. It was all just listening to his tissues, doing what I was trained to do. I was a third-year medical student, and even by then I was pretty good with the musculoskeletal manipulation stuff. And he was so impressed that he came every quarter to my medical school, DO Medical School in Des Moines, Iowa, and spoke to the students. And he was a gruff, mean bastard of a man a lot of the time, trust me. But he was moved to tears every time he spoke to our student body. And he said, I've just learned so much from my daughter, and she was right, and you all are getting a better education. And I think that is true if you're going to go into primary care. Now, if you're hell-bent to be a neurosurgeon or a cardiologist, there are manipulation modalities that you can use in those specialties, but not a whole lot, and it's probably not what you're gonna do. Does that answer the question? Long answer, yes, sir.
Hold on one second, we're getting
The microphone does help, yeah.
Okay. I'm just, okay, so you said that like DO is good for like primary care and then like MD is good for like any like really specialized field. But I'm really interested in emergency medicine, which some consider to be a specialty. So like, what would you recommend technically for like a DO or MD?
That's a great question, and my ex-boyfriend, who's now in DO school, will be very proud of me to say this. I would go on Reddit, literally, and research that, because emergency medicine is a gray area. Emergency medicine wasn't a specialty when I was first entering practice. I was in a rural area in the Ozark Mountains, family medicine, and I took turns with all the other doctors in the surrounding counties to cover the emergency room. We had internal medicine docs in the emergency room. We had OBGYNs in the emergency room. It was really interesting. Really grateful that there's a whole modality now, specialty of emergency medicine. But I don't know the representation from, of DOs versus MDs in that regard. That's what you're asking, right? Yeah. Probably a better place than Reddit to find out that data. I don't know where that would be though. And I don't know the answer. Yeah. Yes, ma'am.
I had a question more about you owning your private clinic and your own practice. Can you talk about how that's been as an experience for you, what opportunities you get, what challenges you have by owning your own practice?
May I use that microphone? Thank you. So I'm gonna do the badass boss bitch move right now. That's right. So I make it look really luxurious and sexy, and mostly it is. I make so much money. I love how much money I make. Here's the other thing. I don't actually work all that many hours, and I'm off in the summers. I leave Texas now. I make twice as much money as I did before I owned my own practice, and I work half as much time as I did before I owned my own practice. Let that sink in for a minute. Okay? And I'm obviously still young. I'm actually a lot older than you think I am. A lot of Botox and filler in my face, which is one reason Mama needs to work and make the money, because that shit is expensive. Now, I'm showing you the good. I'm showing you the Instagram life. Okay? And it is all that. But how did I get here? Okay? It was years of suffering and turmoil. So, I get out of medical school, I completed my residency, allopathic MD residency at the University of Washington, not because I was shunning the DO world, but because it is the best family medicine program in the United States. I got accepted. Yes, you just go. You don't pass go, you don't collect $200, you go. So completed that in Seattle, Washington. And then how did I decide what job I was going to accept? Well, I took the one that offered me the most money, duh. Oh, children, if you remember anything from this talk tonight, please remember when you look at a contract to be suspicious if it's a high dollar contract. If it's outside of the norm, it's probably what we call the golden handcuffs. It's a shitty job, and they have to pay you a lot of money to take it. But I didn't know that back then. It was a gross grasping. I've been a resident eating beans and not having money for 4 years, and you already know how much I love money. So, took that job. It was awful in a lot of ways. I'm gonna not make this a super dragged out answer either. I was fired from my first 2 jobs. Why? Because I was told I was getting paid X and that I would have a bonus structure based on efficiency. Well, I am very efficient. And I wasn't getting paid what it said I was to be paid on paper. And then I got what we now know to call as gaslit by the administrators of it was 2 separate tiny hospital organizations in the Ozark Mountains. I had just gotten married, by the way. This did not go over well with the husband. Why can't you keep a job? I got depressed, I got fat, I started drinking alcohol, not in a healthy way, not that there's necessarily a healthy way, but in a very unhealthy way and amounts. To the point where my mother and brother had to fly up from Texas and have an intervention to try to figure out why I was so miserable. My self-esteem was at an all-time low, and I really hit my lowest point when I was in my pickup truck, actively going to drive into a lake because I wanted to kill myself. Guess who I called on my razor flip phone? I called my daddy. Yes, we had our ups and downs, but he talked me through it. I did not kill myself, as you know, because you see the happy ending. But I'm being frank, I'm being honest with you, that I have very bravely borrowed a shit ton of money from a bank to open a clinic in downtown Austin 15 years ago. It's all worked out amazingly well for me, okay? But I didn't know things were gonna work out for me. I couldn't see anything beyond, oh my God, are people gonna hire me and just lie to me? Because I'm not someone who's gonna shut up. If I'm told I'm gonna be paid something and it's written down, I'm gonna speak up on my behalf. And I was told by family members, not my dad, family members I don't really care that as much of their opinion, I guess, but family members, friends, neighbors, co-workers, just shut up. Why can't you just shut up? What's wrong with you? Like, I thought I was broken and horrible. I thought I was a bitch because I spoke up. Okay, what I now know is that I'm a boss. I'm a great leader, and I'm a questioner. So I just don't fit inside the mold. I don't play well. I'm not gonna say I don't play well with others, because I do play well with others. But I'm just probably not someone, no, I'm not someone who works well in a bureaucracy if I'm not allowed to question what's going on. I'm very much a rule follower, believe it or not, but I gotta buy into your rule, and you gotta let me ask some questions about the rule. And then if I'm on board, I'm gonna help you enforce the rule with everybody else too. But when you shut me down, it's not gonna work. So it works best for me to own my own practice. That's not gonna be the case for everyone. Not everyone has the chutzpah, and it takes a whole another level of courage to open your own practice. But I am being clear with you and honest, because you very well might not hear from any other doctor in your whole training years that it's even possible these days to own your own practice. It's not only possible, it can be lucrative and fan-flippin-tastic. That answer your question? Yeah. Such a long answer. Okay, next.
So when I was doing my research on you for your introduction, I was having trouble describing what you do, like what medicine you practice at your clinic, because it seems like you do everything. From, like, I saw urgent care, like I said, I saw like ADHD treatment. What is it exactly that you do? What patients come to see you?
Thank you for asking that question. And one of the reasons that I am a family medicine doctor is that I love all of medicine. So if you find yourself confused, and when you're on urology, you want to be a urologist. When you're on your pediatrics rotation, you want to be a pediatrician, and you just love all of medicine, all that, you're not broken, you're okay, everything's fine. You just need to go into family medicine. Because in family medicine, we get to do a little bit of everything. And then when I took that job in the Ozarks, it was very rural, very remote, and we didn't have specialists. So I was the cardiologist, I was the psychiatrist. We could fly people if they were super emergently needing something, although that probably meant they were gonna die en route. We didn't do it very often. So I had the great fortune of, it was good that I did do a lot of my training in such a rural area, because I got comfortable with a lot of specialties. So even though I'm in downtown Austin, if you come and see me as a family medicine doctor, I'm gonna do some cardiology, I'm gonna handle some pulmonology, I'm gonna handle some urology, some urgent care, because I was covering the emergency room with my fellow docs down there in the Ozarks. I am not a cowboy though. I know that I'm not a cardiologist, and I think, and I certainly hope that I am appropriately referring my patients to specialists when they need a specialist. But a well-trained primary care doctor can handle a lot. And then I really got in, well, so in DO school, they also like you to pick a little focus. It's kind of like a little doctorate thesis, like as if you were having a PhD. And my thesis was in ADD and ADHD. So I was just always interested in that. Since medical school, I was very well trained in it, very comfortable. So I've always, prescribed and managed for ADD and ADHD folks. And then during COVID, right, what were people really suffering from? Anxiety, depression, a lot of psychiatric stuff. So I took it upon myself to take some extra coursework, get caught up on the latest. And I now see a lot of people, all ages, for mental health. The other thing that happened is the opioid crisis. Everybody's aware of that, right? So OxyContin and fentanyl are what we call Schedule II drugs. Well, Adderall and Vyvanse and Ritalin are also Schedule II drugs. So a lot of doctors don't want to manage these prescriptions anymore because the DEA is always down our throats and down our backs about how we are handling those medications. But as you know, I'm no longer afraid really of anything or anyone. So I keep managing and prescribing meds appropriately. Good question.
I have my own question. Hi, my name's Ashley. What motivated you during medical school, whether it be like a really hard subject or a difficult boss when you were a resident? What was the most difficult part?
Ain't gonna lie, med school sucks. It is so hard, it is so grueling. Residency is even worse. But like a lot of things in life, if you're doing something that you really want to do, your brain will show you the glimmers of why you're doing what you're doing. At times, just enough to keep you going. So let's see. Your first year of medical school, I was speak first person. I was motivated by fear. I had just signed off on a tremendous amount of student loan debt. But also, it's so hard to get accepted to medical school that I was like, oh, I better not F this up. Like, it took so long, and I also will humbly tell each of you today, it took me 3 years to get into medical school. I applied for 3 years in a row before I got into medical school. And I did apply to MD and DO schools. And I would have gone to an MD school had I not gotten accepted to the DO school. So fear will motivate you at times, sheer determination will motivate you at times, and then you'll just see someone who's really cool and they're sick or had cancer or something, and they'll tell you about the attending that you're rotating with and how they saved their life, and you're gonna be like, yeah, that's right, that's why I'm doing what I'm doing, so I'm gonna keep going. So there are a lot of different things that motivated me, and I think I speak for everyone on that. Yeah.
Hello, Dr. Freeman. I remember you from the last time you were here, and I remember you had very insightful thing to tell us about insurance. And I was very curious, like afterwards, when I wasn't able to ask you afterwards, but I'm able to tell you now since you're back. How did you learn to like negotiate like your bill and whatnot for like your cost of care? Because I remember you touting so passionately how insurance is a scam and whatnot, and like how did you know like that you were like advising us like this is how you can negotiate with your provider and like make it more affordable to you and cut the middleman out, the insurance company. And I just want to know, how did you learn that? How did you find that out? And how can providers be in that position to like educate our patients and making sure they have access to care and make sure finance is not a barrier to that care?
Well, thanks for coming back 2 years in a row. I love it. Yeah, it definitely sounds like something I would say. It started for me with questioning everything. So I don't know, and I'm not going to ask for a show of hands if anyone in here, like me, has considered suicide before. But if you ever do, if you're that down, I want you to remember me saying this right now. I want you to hear my little voice in your ear. Just don't kill yourself, because you don't actually know how the story ends. And there is always an opportunity that you don't see. So I think that, I had these intense experiences, I had some real low lows, And then I was gaslit by these first two outfits that hired me. I started questioning everything, including my own sanity, yes. But that questioning of everything has not stopped for me. It only has snowballed and gotten more and more prolific. So when I quit accepting insurance in my private practice that I own 2 years ago, 3 or 4 months after that, it was time to re-up my health insurance. And I just kept putting it off and I kept putting it off. And my life coach, said, what do you want to talk about this week? Oh, man, I am not a procrastinator and it feels super uncomfortable. I've got this one thing to do, I've done it many times, but I've got a block against it and I don't want to do it. So she helped me unravel that I had all this anger against the health insurance companies, and I finally taken the brazen move in my business to not accept health insurance anymore. And I was feeling guilty and hypocritical to even consider writing a check to any of these health insurance companies because I don't feel aligned with their philosophy. So I just wasn't doing it. And now well, not just now, but she helped me see pretty quickly that I really wanted to put my money where my mouth is. Remember, we vote with our dollars in a lot of ways, right? You don't want to spend money, pay a corporation that you don't believe in or agree with their mission. I do think that health insurance is a scam. It is a pyramid scheme. And look, they're brilliant, okay? These health insurance companies get everybody to pay, what's the lowest? $200 a month? I'm being conservative. Does anybody get insurance for $200 a month? No. But let's be conservative and say from $200 to $800. Most humans in the United States are paying that amount of money. I guess maybe if you're over 24, you're not on your parents' insurance anymore, let's say. 2 insurance companies. How brilliant is that? They have massive billions of dollars to hire many levels of people and have beautiful steel buildings. Now, in my 401k retirement portfolio, I probably have some Aetna stock. I'm not completely clean here because I love money. But I just started questioning that whole industry and looking at amortization tables and the data that insurance companies use, and here's the bottom line. It is very, very low probability that anyone is going to get cancer when you actually look at the percentages. Very low probability that any of us will ever be in the ICU with a $500,000 bill. Like, that's the catastrophic stuff that we all worry about when we think about buying insurance. But the fact of the matter is, very rare. The odds are in your favor. And what you're remembering so astutely, and the little kicker that I love to remind people, is that we're in the United States. So none of us can get denied care. You show up at an emergency room, you're going to get care, you're going to get hospitalized, you're going to get treated. Now, I will tell you, if I'm one of those low percentage people who developed breast cancer, or I was in the ICU, I would be grateful that someone saved, or a team, an entity even with a team, saved my life. I would want to pay them. But let's say the bill is $500,000. The bill has to be $500,000 to the insurance company so that the entity that actually did the good work of saving your life gets $250,000, $300,000. So we overbill insurance companies because you never get reimbursed 100% of what you're asking for, okay? So I can see this bill, I'm gonna go to the billing department of the hospital and say, thank you for saving my life. I see that the bill is for 500,000. And then I'm gonna start a conversation like, could you just be honest with me and tell me what you're hoping to recoup if I had had insurance? Let them give you a number, and then it's a conversation from there. I may have a number in my head of what I wanna pay. She may have a number representing the billing company or the billing department of the hospital. And then a negotiation is just a conversation. It doesn't have to be a war. It's okay to like stop and breathe and ask the other person, hey, I'm curious, help me understand where you're coming from, what your thoughts are. The friendlier you can be in a negotiation, in my experience, I don't have a ton of experience negotiating, but I'm a good negotiator. And I think I am because I just look at the person with an opposing goal as, hey, help me understand where you are, what your goal is. Don't worry, I'm gonna let you understand what my goal is. And let's see where we can meet and come up with something. But we also have tremendous healthcare that is affordable and accessible for people who are poor. So if you really are low income, there are several clinics even here in the greater Austin area where you can go because they have grants from the federal government. They get grants from the state of Texas. And they are there to care for people. And I'm saying that because I meet a lot of students, a lot of kids come through and shadow with me and they don't know that. So please know that you don't have to be rich to get good health care in the United States. Did that answer your question?
I have another question. What's a lighthearted, funny thing that happened maybe in your clinic that reminds you of the lighter side of medicine and like warms your heart a little bit?
That's a great question. I do laugh a lot at clinic, but it's probably my own just stupid dad jokes that I tell all day. Lighthearted. Well, we did see this lady the other day, and she was so cute. She came in and she had her kiddo with her, and she kept being all apologetic, and we were just fawning all over the child because there are a lot of pediatricians in Austin, and a lot of people in this city in particular don't know that they can take their kid to a family medicine doc. So we don't get to see very many kids, and we get like all kind of, gooey over them. And I don't have children, so, but I know how to work the stickers. And I get the stickers, and the little girl got to choose her little sticker, and that did warm my heart. It's amazing. It's just a sticker, but every time, it wins. Yeah.
Any other questions?
What is a memorable lesson you learned in osteopathic medical training that you implement in your life outside of patient care? Repeat it.
I remember when you get to be my age, your brain is like a lazy Susan, so you just have to give it a little moment and it comes back around. I remember one time this DO was telling us about this upslipped pelvis somatic dysfunction he had. In English, what that means is he had his pelvis was cockeyed, askew, if you will. And he was having low back pain as a result. And he's a DO, and he's an osteopathic professor, and he was going to his fellow professors, and they were working on him, and it would kind of hold for a day or two, and then just go right back out. And he was teaching in Hawaii, and he said that finally one of his colleagues was asking him, just kept asking him about things he was doing in his daily life. Well, he was running on the beach, and the beach was slanted. So, I'll speak up. So one leg was short like this, he's running like this on the beach, right? So this side's getting pounded, and so of course that side of his pelvis just kept getting out of alignment. And I do think about that a lot. I think about that when I'm jogging or I'm walking, or if someone comes in with an upslipped pelvis. Well, that's not fair, because you asked me, where do I apply it outside of the clinic? So outside of the clinic, I apply that to myself when I'm exercising. I like to remind myself to try to be symmetric in my movements. God, that's still kind of clinical. I'm a nerd. All right, any other good? May I ask your position, the gentleman in the back, is you might be undergrad, but
Very older student. I'm Dr. Rudy Garza. I'm the Chief Medical Officer here at St. David's Medical Center. I'm over the volunteers. I work with Chi, and it's a pleasure to have you here tonight.
oh, thank you. I was so hoping that you weren't like in the billing department. So I'm relieved. And feel free to challenge me on anything that I'm answering or add anything for the, we want them to hear from as many docs as they can, right?
You've given them a very good perspective on the DO, MD. You described the controversy in the past. I remember my father being very biased about that as well. But you can really do anything with either one of those degrees. I think you explained it all very well. These students it's such a competitive field for them. You said you applied to MD and DO school, and I guess one of my questions would be, do you recommend that they do that as well? I mean, to have a love for osteopathic medicine, they should go for that, but just as part of their application process, should they broadly apply?
Oh, for sure. Yeah, if you want to be a doctor, stay the course, apply everywhere you can, and there's an old-fashioned saying, you dance with the one who brought you. So, if you want to go to that prom and that person you wanted to ask you didn't ask you, but somebody else did and you said yes, when you get to that prom, you're going to dance with the one who brought you. That's just the nice thing to do. So, if you get accepted to DO school or MD school and it wasn't your choice, my advice is to support that entity, because that's the one who has allowed you to be a doctor, which is still, I think, the greatest profession in the world. Would you do it over again if you had to do it over again?
I would, but it would be, I think it was kind of having being naive to how hard it was going to be was helpful. I mean, you talked about how hard medical school was, residency, and I've explained this to students as well when they ask, and I say, yeah, it's really hard. It is really, really hard. I don't care what class you're taking in undergrad, it doesn't compare when they drop a phone book on your desk and say, you're going to memorize that by the end of this semester. And it all's like foreign gibberish. It's like a book of organic chemistry. So it is hard. I think that being naive helped me through it, but I would do it again. I had a wonderful career, enjoyed helping a lot of folks, and as you said, I think it's one of the best jobs you can have.
Yeah, I would do it over again too. Yeah. So that's pretty strong. Your 2 attendings in the room. Are there other attendings in the room? Okay. Just checking. Question.
Hello again. I wanted to ask a question on, since you've been a provider, how exactly do you deal with difficult patients? I'm sure there's some that maybe doubt what you do as a DO, your philosophy as a DO approaching medicine, or the things that you prescribe, or just are misinformed. How do you deal with that?
If I may. Yeah, so that for me has evolved. When I got out of medical school, I had a pretty rigid way of looking at the world. The easy low-hanging fruit to talk about are vaccines. Like if someone was, refusing a vaccine, I would pretty much lose my shit and feel very judgmental, which I'm sure showed on my there then unbotoxed face, still expressed a lot. Yeah, very judgmental, definitely had a I know so much better than you do for your health, and that has very much changed over the years. And I think that's just a natural evolution. It feels great. It's so much easier on me now. I just say to myself, this person is allowed to have their thoughts. This human is allowed to have their opinion. It literally has nothing to do with me. Oh my gosh, that is so much easier than like trying to fight him and trying to convince him of something. And so I now say things like, Mr. So-and-so, my job is to lay out the buffet, if you will. You get to pick from the buffet what you want. You don't have to eat everything on the buffet. You may not want anything from the buffet. You might want everything on the buffet in seconds. My job is merely to lay out the buffet. Based on the science and the knowledge that we have today, I recommend for you a screening colonoscopy, a tetanus vaccine, yada, yada, yada. Literally, I don't have an emotional need any longer for their outcome to be a certain way. Now, how many people here, and I would like a show of hands, don't resonate with what I've said? And what I mean by that is, how many of y'all think that if you were a doctor tomorrow, magic wand, you would be like, yeah, I objectively would not be emotionally connected to an outcome on that. How many of y'all think that like going in, you would just be like that? Show of hands. One? That wasn't a hand.
I didn't understand. You mean like you would be like.
If you were a doctor tomorrow, would you be unemotional about a patient who refused your advice that you know to be the best thing for them? Okay. Okay, so we have 2 out of this whole room. Isn't that interesting? Yeah. So I think it's just natural to evolve that opinionated thing. But it sure feels better. Right? Did that answer your question?
Just to close it up, what's one thing about medicine, like new advancement, that you're really excited about right now, or something new you've learned in your practice recently that you're looking forward to implementing?
Thank you for asking my favorite question of the entire night. Okay, so here's what's really cool about medicine. Whether you end up being a physical therapist, you're a PA, you're a doctor, you're a nurse, whatever you do, you will never know everything. Okay, so if you have a thirst for knowledge, that kind of brain, you're going to be endlessly challenged. And when you know what you know, like when I went to medical school so many decades ago, what were we taught then? I was taught that hormones were horrible for women, that you would not prescribe estrogen or progesterone. No one was even talking about testosterone for menopausal women back then, by the way, because the Women's Health Initiative had come out and it was misinterpreted. Now I am in, so I do all the things that I mentioned earlier at the clinic, but mostly my physician assistant does the family medicine. I almost exclusively treat hormone therapy, provide hormone therapy for women going through perimenopause and menopause and men in andropause. I am absolutely, completely passionate about hormones. And part of that is because when I was trained, there was this certain knowledge, and now it is literally 180 degrees changed. I used to get very angry about that as well. I'd be like, oh my God, how can I even represent Western medicine? Like, one minute butter's good, the next minute butter's bad for you. Eggs, cholesterol, like, okay. What really is happening is it's just science, okay? And science evolves as humans learn more and different things. So be gentle with us. We're doing the best we can. We're just evolving with science. So I would say the thing I'm most excited about, the change in medicine, is this whole knowledge that I can safely prescribe estrogen, progesterone, and even testosterone for my women in menopause. It's just the best. And then the testosterone, because even though there wasn't a women's health initiative on that, when I was trained, it was, be very wary of testosterone in men, even if they have low testosterone, once they're over their in the 50s and 60s. Now what we know is there's all this cardiovascular protection and bone density protection using exogenous testosterone. So it's been really fun to see that change. Did that answer your question?
All right, with that being said, that concludes our Q&A session. If everyone can give Dr. Freeman a huge round of applause. That was a lot of talking, so thank you so much. I'm sure you're exhausted.
Thank you. No, I'm sure you can tell, I love it. I don't have children, as you know, and it's just fun to look out on these bright, each of you is so physically attractive. I don't know how that happened, but just wish the very best for each of you. It's going to be messy. Change your mind. And thanks for letting me talk to you for so long.